Why should people with diabetes be seen regularly by a podiatrist?
All right, so diabetes is often very misunderstood. I often will see people when they are initially or first diagnosed with diabetes, and they come in just very, very anxious because they hear all the horror stories of limb loss, and they think, oh my goodness, this is going to negatively impact my quality of life. They're happy to hear when I tell them that my patient population who are diabetic are across the board have better quality of life as they age because of the blessing that diabetes brings about is you just have to be more aware and take better care of yourself. None of us really like having to focus on doing what's right and best for us, but it certainly makes you more aware and proactive about exercise, watching what you eat, diet, avoiding some of those sweets that we all prefer. But in reality, when we choose to steer away from those things, not only is our diabetes and our internal health better, but we actually have much higher quality of life. So specifically with foot care, there are three things that we are really focused on with diabetes. One of them is circulation. And so poor circulation is something that can lead to a lot of other problems, or what would be problems in the feet become big problems if not addressed properly. Second, in diabetes, very common, there's neuropathy, which is a lack of feeling in the feet. Even to the point where I've had plenty of patients who, were standing on hot asphalt or on hot beach sand, blistered the entire bottom of their feet because they didn't realize it was hot. Even to the point where somebody has stepped on a roofing nail and didn't realize that they had any kind of an injury until they saw the blood in their shoe or their sock. So you've got the poor circulation, you've got lack of feeling to know when you need to seek medical care. But the third thing is actually, I would say, as important as those two things to address, and that's awareness. And that's why we ask people to inspect their feet, to come in, every couple months on the most regular basis. But a lot of people only need to be in once a year, and even a couple. Some people are in such good health that I tell them just every couple of years, come in, let me check these things out, and kind of reevaluate, what your needs are. So the needs are a little different depending on the severity of we call comorbidities, or if you have other issues, whether it be thick toenails or each patient has their own needs.